I started working as a nurse in pediatrics, so I had a little bit of background in pediatric health and then started the process of becoming a pediatric provider when I had my son. And I think conceptually, there's a lot that you learn as a provider that is ideal, that doesn't necessarily play out in day-to-day life with kids. I think that first year of being home with my son and having that newborn rocked my world completely. Like, I was seeing patients that would present perfectly on the growth chart, or that would be sleeping through the night by a certain milestone, or making these developmental milestones that my son wasn't making. And in my brain, I was like, he's behind, or I was getting worried. But being able to understand that from a mother's perspective as well, it now helps me, like, with my patients, to be like, no, they're not behind. There's, a spectrum of what's normal, and just kind of trying to give validation to those parents and to ease some of that anxiety that you have as a mom, especially as a new mom, about what's normal, or is my kid doing all of these things that they should be doing? Are they meeting these milestones? Are they gaining weight appropriately? It's really, really concerning as a new parent, and I get that anxiety, especially as a breastfeeding parent as well too. I think in those initial first days of life, when you're direct breastfeeding especially, you're not able to know exactly how much your kid is getting. And so we use that weight in the office as like a marker of how they're doing. And I think there's a lot of anxiety about, like, did they gain that weight? Are they losing weight?